Everyone, so our topic is multiple sclerosis and the role of myelin. As you can see, we divide our topic into 3 different sections. First, going to focus on the first column and then move on to the right side. So first off, what is MS? MS is basically an autoimmune disease, which means that the immune system is attacking its own body. And this, unfortunately, as you can see in figure number 1, is leading to something as called demyelination. Demyelination just means that the myelin sheath around those nerve fibers is damaged or affected, which then leads to several messaging issues between the brain, spinal cord, and the rest of the body, as well as back. So we have problems with sensation and problems with movement because of that demyelination. Then where we have basically 4 different types of MS, as you can see in figure number 2. So the one that we're going to focus on is the blue one, the relapsing remitting MS. Relapsing remitting just means that basically those individuals experience a relapse where they have those kind of MS symptoms, but then they're afterwards able to recover from this almost completely. So their curve is going up higher though, so with every relapse they're not able to recover as much as before. And this then can also lead to those other 3 types of MS, which are the progressive types as seen in the orange, green, and red. So basically what happens is that the recovery is getting harder or is not as possible as before, and also the progression of the disability is always going up higher. Now we're going to talk about some effects of MS on the daily living. So as you can imagine, because of that communication issue between brain, spinal cord, and the rest of the body, people with MS experience issues with balance and stability, so they are more common to experience falls as well. So in figure number 3, you can see that more in detail how nerve transmission and conduction is slowed down due to that damaged myelin, and that basically just means that nerve impulses or motor signals from the brain become uncontrolled, slowed, or stopped. And then in figure number 4, you can also see some common symptoms of MS. So we already talked about like how falling is an issue, so walking difficulties, numbness and tingling, dizziness, vision problems because of no sensation, everything, and then also pain, fatigue, muscle spasm, or even depression is an issue. So let's now talk about some possible treatments. Some key points first. It's important to know that there's no known cure for MS itself. That means there are different types of approaches, but none of them are exactly perfect to actually cure this disease. And then most of those therapies and concepts focus on RMS, which is like the easiest to treat because like the beginning stage of MS basically is a relapse remitting one. So you, after diagnosis, you want to start as early as possible to slow down the progression of MS, reduce the relapsing rate, as well as reducing the brain lesions that are built in the brain, which you can see on MRIs usually. So now we're going to have a closer look at our figure number 5. So basically this is a flowchart explaining how different therapy approaches can be worked with for an individual. It's important to mention that each MS is different for the person, so we first have to define this type of MS to then choose an appropriate therapeutic strategy with the individual. I separated this out into 3 different sections. So one section is the maintenance escalation therapy on the left-handed side in the blue, which is basically an ongoing or chronic type of therapy where medications or other types of therapies are trying to block the immune system to or block it out so that it cannot attack its own body anymore as much. So as you can imagine, the problem with this one is it's chronic and ongoing. That means once you stop it, the immune system would, start attacking its own body again. So this is a therapy that you probably have to live on for a longer time. Then in the green section, we're going to look at immune reconstitution therapy. So this one is kind of the one that gets closest to the cure so far. It's a short course therapy, so it's not an ongoing or chronic one. And this one is hoping to result in a long-term qualitative change in the immune function. So not trying to block the immune system, we're rather trying to modify it. And then on the right side, in the yellow column, you can see some symptomatic therapies. So those are non-MS related. Basically, we're looking into some symptoms that arise from that disease, but that are not purely caused by MS itself, such as pain or muscle stiffness, etc. So we're using physical therapy and also meds to work with that and to help the individual basically have a better living situation. And then also one more thing that we have to mention is that there's a new parameter that determines the effectiveness of MS, the no evident disease activity, and basically the goal of that one is that there's no clinical relapses, a lack of clinical progression, and absence of new disease activity, and the goal is to basically sustain and achieve NIDA for as long as possible for an individual with MS.